Hello. So, hi everybody, and welcome to another episode of Healthy Woman Magazine podcast. Today, I have with me a wonderful doctor, Dr. Laura Gotz. So, hello, Laura.
Hi, Anna. Thank you for having me.
Thank you for being my guest for today in the Healthy Woman Magazine podcast. Today, we have a very interesting topic, a very interesting conversation about women's health, and it's all about preparing for menopause. But before we hop on to that, please let me introduce you to Dr. Laura. She's a gynecologist, a psychosomatic consultant, and I want you to explain this, a mindset coach, and author. So, Laura, could you please tell us more about you and who you are and what you do? I know you're in so many things, and I'm so proud to know you. So, please.
Yeah, thank you for noticing that I am in I'm doing a lot of things and they are all related to women's health because I really wanted to learn everything that is to know so I can help women as best as I can. So I do believe that people know what a gynecologist does. So I treat women, doesn't matter the age, doesn't matter the illness. They all sort of come to a gynecologist for a referral. And when I realized that a lot of women actually have psychological issues, maybe these psychological issues determine the organic disease or vice versa. So that's why I trained to be a psychosomatic consultant to see how uh, stress influences your body, your symptoms, and then I carried on into transformational mindset coaching because we produce our stress, we produce our illness most of the time, especially women. We care so much, we overthink so many things, we want everything to be perfect. So, of course, then we will start to have issues like anxiety or panic attacks. And if we do not express the feelings, then we will start developing other symptoms like belly aches or hormonal disbalance, and we start to bleed abnormally. A lot of the times, really, especially in young women, we will have psychosomatic disease. So our brain, our stress actually influences our body, and then we will start to have these special symptoms.
Okay, it's all amazingly interesting. And as the today's topic is menopause, I'd like you to go into the definition a bit more because we all know what menopause is, like around and below. But could you please explain?
Yeah, so I have a lovely definition because I do know, and that's why I wanted to talk about this topic. I do know that women fear menopause. When they hear about it, they think, oh my God, this is this monster that is coming and it will change my life. I tell women that menopause is a hormonal period in a woman's life. So, as children, we have one hormonal period with little estrogen, then we develop, yeah, into young women and we get our periods, and then we have regular periods, and then we get pregnant, maybe. So, women who want to have babies, and at one point, we have another hormonal period, again, a decline in estrogen, and of course, we will start to see changes. We know how it is, how it was for everybody, now, or for every woman when we changed from being a little girl to a girl who got her period. It was a huge, huge thing in our lives, and it is the same with menopause, but it is not that monster that we think it is.
That's good to hear. That's good to hear. But I'm not anywhere near that yet. But lots of my clients are phasing through, going through menopause, or they have the symptoms and it's starting, or some of them they're at the end. Few women, they face these horrible effects. Few women say, "Well, nothing changed. Just a bit of mood swings there, here and there." But how does it really affect women, Laura?
I really loved how you said that, and this is one of my points. You are nowhere near menopause, Anna. Usually, women enter menopause around 50, but some actually start developing symptoms where they're 40. So, what I'm trying to say is that a lot of women are not ready. They think that is something that they will get when they're 70 or 80, at the end of their lives. But actually, nowadays, when we know we will be living till 80, 90, actually we will be in menopause 40 years. That's almost half of our lives. We will be in this period where our hormones are going to be decreased. So that is why we have to pay attention to this and really treat it like a normal thing and start working on our mindset at the beginning. So even though I'm also 30, of course I am maybe my mother was she was 45 when she got into menopause, so maybe that is something that is awaiting for me, but it doesn't mean I cannot prepare for this period when my body will start to change. So we first start to change in our mind, and then our bodies will change. If we accept this and we love ourselves no matter what, we will control the symptoms easily, and then we will feel like it is the normalest, the most normal thing in the world.
Yeah, but can a woman really start preparing for it? Like, what is the preparation process? Like, does it have to do with the mindset, nutrition, of course, or what is your point of view?
Of course, we have to start with the mindset. We have to know when we're 20 or 30, at least the information, what is going to happen, so we are not caught off guard. And we also need to know and tell ourselves this is not going to be a bad thing. A lot of women associate menopause with not being a woman because they stop having estrogen levels, they decrease, and then they feel like they're no longer a woman. So it is all in their head. They think that they will be ugly. Women think that they are old maids. We know that when you are in the menopause, you cannot have children. So some women are really affected by that. They do feel that they are less women when they stop having their periods because they have related bleeding with this form of youthful femininity.
Hood, like womanhood, is
Yeah.
associated with our periods for some reason, when that's not the case, of course.
So actually, women who go through menopause with this positive mindset, they say that they experience true liberation because they don't have to pay attention to their periods. They can have sex without, fear of getting pregnant. So if you do go into this period with this positive energy, you are, some say, more woman, one woman than before, because you do feel free to do whatever you want, to go swim without fearing that you're going to bleed, or going to a wedding, without fearing, oh my God, what is happening?
Yeah, the
So
struggle is
definitely,
real.
if you prepare here, then you will be ready to accept whatever is coming. And of course, the decline in estrogen will start manifesting on your body. And like you said, some experience it with heavy symptoms, some not at all. For some, it's a natural transition. Um, and you asked me, how can we prepare? So after our mindset, after working with our psyche, we start to really think about this period and work on our bodies. So it is never too early to start. Definitely a good nutrition, because when the estrogen levels start to drop, a lot of women will start to gain weight because we are no longer that energetic. Therefore, if we prepare our body, if we have an awesome body before we reach this phase, we will have a better transition. Then we should start doing more sport. I am also quite a couch potato, but having these in mind, not only the benefits for my health now, that I know, okay, in 10 years, in 20 years, I have to work now, so I feel way better afterwards. We should start doing sports. And I have an example I'm going to share with you. You can also Google if you are interested. So women who are interested in these sort of miracles. There was a case of a 70-year-old woman who hadn't taken care of her. So when she was old, we have this hunchback that the women have this problem with their back, and she could barely walk because of this. Of course, osteoporosis. And when she started doing sports, she started doing dancing and going to the gym. You could see the changes in pictures, like 1 year after. She was normal. Her back was straight. She did look younger, and it is all because of sport. So just going into menopause and suffering from, of course, these normal imbalances and hormones, it doesn't mean it is the end of our life. So we should just treat it as a normal aspect, normal period, and make the most of it and really take care of our bodies even after that.
Okay, it's all very enlightening and bright. I must confess, because yes, indeed, most women they enter menopause in a bad mood, like, oh, I didn't need that now, or what am I doing now? Or they tend to blame certain things on menopause. Like, I've got a lot of clients who are like, okay, my metabolism is slower because of menopause, or I've gained weight because of menopause. We both know that this is not always the case. Of course, yeah, moods change. We've got all these changes in the hormones, but it's kind of impossible for a woman to gain lots of weight and just blame it on menopause. What do you think?
Yeah, this is what I tell young women when they say they gained weight because of the pill. Of course, you will have hormonal, it's regulated, the hormones will be regulated, and maybe you will start to develop some cravings, or maybe the metabolism will change, but you will not have the fat if you don't eat the cake. So I tell them, if you control what you eat and your sport, so if you really take care of yourself, you will not gain that much weight that you say, oh my God, I gained 10 pounds. No, this is not true. The pill doesn't uh, provoke weight gain, and also menopause doesn't do that directly. If you take care of yourself, then you will be as thin and as energetic as always.
So, Laura, what would you say about younger women who enter menopause? I don't know why this happens, but I've known a few women who've entered menopause by their 30s, 33, 35, and women who didn't get the chance to have children yet. So, why does this happen?
A lot of the times it is a genetic composition. So if all of the other women in your family have gone through menopause at an early age, then you are most likely to do that yourself. Or a lot of the times when we do test these women, we see that they had hormonal imbalances all their lives. So it was a problem either in their ovaries or in the other hormonal glands in our brain that control these symptoms. And we do have women, because I also help women with infertility that go through these issues. We can support them, let's say, artificially. So we give them hormones to simulate a normal period, and they do get pregnant. So there is a possibility to do that. We can even, if we, scientists, we can even help a woman who has been through menopause. If we induce hormones in her, we can theoretically help her get pregnant. But it will be like an artificial pregnancy, this artificially sustained pregnancy. So if you are 60 and you want another baby, it's not ethical, but in theory, we can help you do that. As for the women who enter menopause very, very early, and do not want to have children, there is just no problem in accepting that. But I also I analyze the patients, individually, and I tell them, if you are 35, like I said, maybe you have 35 years more ahead of you, or 40 or 50 years, and the lack of hormones will really change your body. So I would recommend that these women really start a hormonal therapy, a substitution therapy, because estrogens are very good for our mental health. They are very good for our circulatory system, so for our heart. And with a decrease in estrogen, we have a higher risk of myocardial infarction. So we will have heart attacks, and we don't want to do to have that. We don't want young women having this sort of issues. Um, so if they are very young, we will support a hormonal therapy, and if they've reached 50, we can discuss with the woman and see if she would like that. We will analyze her symptoms, and if we think that hormones will be beneficial to her, so she has less symptoms, then we will prescribe that. But some women, like you said, just go and they're so happy in this period and they don't need anything.
What happens with the sex drive of menopausal women? I just have this question. It just came through my mind.
Yeah, definitely. A decrease in hormones, you would expect that the women will be less likely to have sex, but I would say now it's not the case. Maybe 50 years ago, when a woman was 50, they didn't have any relations because of many factors, maybe religion, maybe they got tired of their husband.
So it
uh,
was like a social
yeah, it
thing, not
is
just a
usually.
physical thing.
Yeah, I do believe menopause is a social thing. So, like I said, that just telling a woman after she got into menopause that she is no longer a woman, that plays with her head. But women who really accept this, then they will start to think differently. And like I said, a lot experience a new sex age, let's say, because they don't have to have a condom. They don't have to think, oh my God, honey, not now because I'm ovulating, or not now. They are they are liberated, so they can enjoy sex. And usually now I have some patients who yeah, with we know divorce rates are high. 1 in 2 or 3 couples get a divorce, and it's usually around that time, 40, 50. So just the fact that they got a new partner, motivates them to have sex. Maybe they change the partner in order to have better sex as a woman, and they feel like at this age they are even allowed to have wild sex, because when they're 20 they think, oh my God, what will people think of me, and this, and I'm ashamed, and look at my body. But women with their 50, they love themselves, they know who they are, so they're like, let's do this.
Yeah, I think this kind of mindset in women started the last few years. So by the
Mhm.
time we are 50, I think it's going to be totally different. Like it's a new era of
Mhm.
women's liberation in this kind of in sexual aspect, right?
Yeah, so women really await this time, because it is special. We all know how it is. One week of the month when we have our periods, and we feel bad a couple of days before, then we bleed. So I would say 2 weeks every month is just like not perfect. But afterwards, you don't have these problems, so you're always ready to go.
Yeah. So, what would you say to women who are younger and they're like facing not so good symptoms with their periods, and women who are older and they're going through menopause right now? Wouldn't you tell them like to enjoy each phase of womanhood? Because I think this is what we have to celebrate as women. It's the different phases and changes from early age, like teenage years, when we first have our periods, until uh, after menopause. What would you say, Laura?
Definitely, I encourage women to love their bodies and love themselves no matter the age. So now we just talked about menopause because it is this misconception that it is a bad thing. And this is what I do with women in therapy. I have I have two methods that I apply. One of them is spiritual. It's called femindipity, and I help women connect with each part of themselves, like all of the women in themselves. It starts with the young girl, then the pubertarian girl, the young woman, then the mother, then the career woman, and then the older woman. So we go through this sort of meditations and we try to connect with each woman inside of us, and we ask her how does she feel in that particular time, and what is good and what is not so good. So at the end you integrate all of the good things and you realize that there is no perfect time, just one time, between 20 and 25, as a lot of women think. No, perfection is when you say it is. So every day should be the perfect time to celebrate you as a woman, uh, regardless of the hormonal imbalances or how your body looks. And the second method that I do is more psychosomatic, where I help women really connect with their body. So really listen to the symptoms, see where do they feel pain, where do they feel the hot flashes, um, so they really understand, okay, if my breasts are now very sore, what does that mean? Where am I in the period phase, the hormonal cycles? And how is it when I'm in the menopause? How does my skin feel? How do I feel myself when I touch myself? It's all very intense, and a lot of women just um, like connect with their body maybe for the first time in their life for real. And of course, these women are going to be more sexual afterwards. That's why it's quite sad that they feel this at 50 after they had so many years to touch themselves, and not with 20. But I have even 20-year-olds to go to this phase, and really connect even with the women in menopause. And then they have a switch in their mindset. That's what I love about mindset work. And they're like, aha, so I don't have to wait till I'm 30 or 40 to really to live my life and be free. I can start now, and I don't care what everybody says. I will do this. It is quite, like I said, transformational work, and I love it, to give the women the power over their own body.
Yeah, I mean, this is so encouraging. I mean, I love this. I didn't know this, but I love this aspect of your work. I mean, helping women, connecting with their body. I think it's so precious because there are so many women disconnected from their body and their sexuality. But I think that this is another topic we have to go on at some other time because it's really interesting, Laura. Yes.
Yeah, we'll see definitely, so we can help women really, really live every day, like I said, to perfection, to the maximum, and
Yes.
really enjoy themselves. Mhm.
So in terms of menopause and supplements, so do you suggest any supplements? I know many gynecologists they suggest. Me as a nutritionist, dietitian, I also suggest a few teas and supplements. But what about you?
um, like I said, it depends on the women. There are women who don't have symptoms, so they don't really feel the need to take anything. But
Mhm.
others do really need something else. They say this is the worst period of their lives, because some symptoms can be very disturbing, like hot flashes to the point that they cannot really work, they cannot concentrate at work.
Wedding.
Yeah, or sweating, they cannot sleep, they wake up and all the bed is like it's
Yeah.
water, because of this problem. So yeah, we do want to help women. It is we try to give her quality of life. So just telling women, you'll get over it, it's just normal in your life. Yeah, it is a normal medical aspect, but her quality of life is really bad right now. For other women who experience dryness of skin, or the dryness of the vagina, so maybe that's why they're not having sex, these women, because of the lack of estrogen. And not only dryness of skin, but we know what that means. We start to have wrinkles. And for women, when we see that about like 40, it gets like really intense, and no amount of Botox will help you if you really don't don't take care of the problem at its source. So that's why you can start taking supplements. There are various from 100% natural supplements. So you can start drinking green tea that is good right now. Also, it's antioxidant and really take care of your calcium levels and other vitamins. You can also try phytoestrogens. These are estrogens from plants, so they're all natural, and you can try to see how you respond to them. For example, you can start eating soy. So that is the most common therapy. You can eat it or take it as a supplement in capsules, and of course many other things. I also work with women regarding mood swings, hot flashes, and yeah, all of these emotional aspects of menopause. I use essential oils. So if you do diffuse lavender, or you diffuse what is this in German? It's Salbei. Oh, sage, sage
Yeah,
in English. Then you start to feel better, definitely. So you can see which sort of natural
yeah,
aspect best suits you. And of course, we are both, very, we support nutrition and a healthy lifestyle. So ladies, if you are smoking, let me tell you, your skin will get worse in menopause if you continue to smoke. So just look on pictures, look at women when they're 50, they're not smoking, see their skin, and then women when they're 50 and they're smoking, they look like they're 70 or 80. So because smoking reduces the blood flow to your skin, so you have a skin that is already not well nourished, and then you reduce even more nutrients to it. So yeah, start living healthy, and hopefully not when you're 50. Do it now. Start with 20, 30. Start doing this, and you will feel much better afterwards, and you will thank your younger self for taking so good care of you.
this is great. This is great information, Laura. Thank you so much. But where can we learn more? Where can we find more about you?
Well, if you Google, I think you will find some articles, but there are even actresses with my name, so please approach me over my website. This is www.thisisyourpotential.com. I also have a private website, which is Laura S. Götz, z.com. I'm also an author. You will find quite a lot about me, but I do believe that you can also ask Anna if you would like to talk to me, and we are always in connection, always trying to do something amazing for women's health. So yeah,
And
I'm very
Instagram,
excited.
you're on Facebook as well. So if somebody types "This is your potential" or Dr. Laura Gotz, I mean, you're out there.
Definitely, you will find me, and if there is an account on Instagram with Laura's Got This, for example, you will find my photos and photos of my cats. This is Your Potential is my coaching business, so definitely you will find a lot of articles on me, and even more with time, because I'm on a mission to change the world for women and to help them be happy and healthy. So that's why I'm in connection with Anna. Anna has the same mission, and we will do even more amazing stuff also in the coming months and years.
We certainly do. And thanks again, Laura. Hope to see you soon again and discuss more amazing topics like this. And thank you, everybody, for watching